In the program Kazakhstan International Vectors, international relations, political views, economic solutions and social innovations. Further, you will find out when there will be 25 million Kazakhstanis. How does the UN care about women's health in Kazakhstan? Where are the infants weighing 500 grams being nursed? The future of a nation depends not on the number of cars, but on the number of prams. Urho Kekkonen, famous Finnish politician, 8th President of Finland. Since the beginning of the 20th century, scientists are calling the growth of world population a population explosion. The number of people living on the planet has reached 8 billion in 1820. By 1927, the number of people in the world has doubled. The 3rd billion was recorded in the 60s of the last century, the 4th billion in the next 15 years. The date July 11, 1987 was announced by the UN the birthday of a 5 billionth man. United Nations projects the world population in 2020 will amount to almost 7.8 billion people. In 2050 it will become more than 9.1 billion, and in 2100 it will even exceed 11 or 11.2 billion. The world population is increasing at an exponential rate. However, this happens not everywhere. For example, European countries are facing the challenge of reducing the birth rate and aging of population. In China, due to birth control measures, there is already a strong gender bias. The number of men has greatly exceeded the number of women. Against the background of an unlimited growth of the population in many countries, in most of the CIS states, fertility decline is observed. According to the UN, by 2050 the population of Russia will shrink by 20 million people and reach 120 million. In Ukraine, the population may be only 33 million people instead of the current 45.5 million. In Moldova, the population will reduce to 2 million instead of the current 3. Kazakhstan is an exception to this background. According to all the same UN projections, by 2050 the population of Kazakhstan will increase by 4 million and will exceed 21 million people. There are also more optimistic forecasts, which state that the Republic's population will increase to 25 million people. The birth rate, respectively, for the last 25 years has grown by 9.8%, and the mortality rate has decreased by 6%. Such a difference suggests that the natural population growth has significantly increased and, of course, increased the size of our population. I mean, the number of population is one of the basic fundamental principles for ensuring the national security of the country. Today, the state allocates significant funds to improve and maintain the health of the population, equipping hospitals and training doctors. It should be said that fertility rates are improving, mortality has reduced, and an average life expectancy of Kazakhstanis for the last 20 years has increased by 4.4 years and now equals to 72 years. Availability of high-quality medical care and common welfare, an important factor which will further increase the length of life of Kazakhstanis, according to forecasts up to 82 years. Maternal and infant mortality rates in Kazakhstan are reducing, whereby what is being taught at the Valiology college classes. Women's health has a direct impact on the demographic situation in the country. Prevention of various diseases and a healthy lifestyle before pregnancy are main measures of prevention of healthy motherhood. There is a so-called index of women's health. It is the percentage of healthy women who do not have any diseases of total 100% of women living in the country. So this index, it is about 15 to 20%. That is, when women are pregnant, during their pregnancy, while the medical observation doctors identify those or other diseases. Deficiency anemia, kidney disease and hypertension. Those are diseases common for women and often especially dangerous during pregnancy. Treatment of any disease before pregnancy is called by doctors a preservative behavior. its formation has been directed in the state goals in the health sector. No less important, it is to preserve the reproductive health of both women and men. The reproductive health distinguish three main areas. This primary is about creating a healthy lifestyle of adolescents, giving them the skills of healthy sexual intercourse and examples in the family, of course. A healthy lifestyle means giving up bad habits, smoking, alcohol and drugs. The second important trend in preserving reproductive health, pregnancy planning advice, including getting information about contraceptive methods, intervals in the birth of children, etc. Offices for family planning are organized, I think, in all clinics of our country. This trend is supported by the Ministry of Health. In these offices, regular medical staff is working who provides assistance to the population, helps on the decision to reproductive problems, addresses issues of family planning. That is a question of contraception, prevention of unplanned pregnancies if necessary, directs to a more narrow specialist who help to realize their reproductive potentials. The third main direction is therapeutic, when a person is facing problems in the reproductive health and the various hospitals help to identify and cure the disease. In Kazakhstan for more than 20 years, methods of assisted reproductive technology have been working. Over the years, with the help of in vitro fertilization in the country was born more than 10,000 children. In the event of pregnancy in women, it is very important to see a doctor at an early stage and register at a clinic up to 12 weeks of pregnancy. Quality of antenatal care. We say effective perinatal technologies recommended by the World Health Organization, such as a safe delivery and effective neonatal care, protection and support of breastfeeding. Accordingly, these are the programs that are being implemented in our medical institutions, and certainly of a great importance is well-resourced health organization itself. These targets were stated as a priority of the state program Salamat T Kazakhstan, which operated in the country in 2011-2015. Since 2016, the new health development program is being implemented, Densaulıq, which is also aimed at the formation of an integrated healthcare model focused on the needs of the population. We have more than 250 organizations in the country that provide obstetric gynecological care, and there are more than 4,000 obstetrician gynecologists. So the security of obstetrician gynecologists per 1,000 live births is 10.3 obstetrician gynecologists, and naturally it has done much to improve their skills, like the continuous increase of qualifications. Educational events are being held. Significant contribution is made by Republican organizations, such as our Research Center of Obstetrics and Gynecology in Astana and the Scientific Center of Maternity and Childhood, which are directly involved in curatorial organizational methodical assistance to the regions. All medical institutions of the country are divided into 3 levels of regionalization. The levels are determined primarily by the material and technical equipment of the institution. To medical institutions of the first level, women with physiological pregnancy are being sent. To the second, with the average complications, and to the third, women at high risk of preterm delivery. First level of regionalization of medical facilities, 180 organizations in Kazakhstan. The second level, about 45 organizations. Level 3, 31 organizations, regional perinatal centers. There are 2 organizations of the Republican level. Scientific Center for Obstetrics, Gynecology and Perinatology in Almaty and the National Research Center of Maternity and Childhood in Astana that provide highly specialized obstetric gynecological perinatal care for the female population of the whole country. The patient is being sent to the organization which has all the necessary resources to save her life and the life of the child. The principle of regionalization is aimed at providing high-quality medical care for newborns, including premature. If to the second level of regionalization organizations, pregnant women are being hospitalized with gestation of 33 weeks or more, then to the third level of regionalization, pregnant women with even shorter term of gestation. Since 2008, infants weighing 500 grams in Kazakhstan are considered live births, according to accepted international standards, and such babies are successfully nursed here. In 2008, with the adoption of the new criteria of live births, the infant mortality rate rose sharply, but in 2010, with the introduction of modern methods of nursing, it began to fall again. During the years of independence of Kazakhstan, the infant mortality for children under 1 year old decreased by 3 times. The maternal mortality rate has decreased by more than 80%. The United Nations Population Fund aims to ensure that every pregnancy is wanted and birth is safe. One of the main missions of the organization is preservation and improvement of maternal health. Kazakhstan sets the following ambitious goal: to reduce maternal mortality to the level of countries in the Organization for Economic Cooperation and Development. This is the decrease in the level till 45 to 100,000. Here, of course, our experts say that the reduction from 55 to 11.7 in the main aspect was necessary to work on the hospital level to improve practice or obstetric services at maternity hospitals. It is now already necessary to do the preventive work, particularly to work on reducing the number of not desirable pregnancies, the number of abortions, the number of sexually transmitted infections. In 2010-2015, in the eastern Kazakhstan region, a joint project of the United Nations and governments to reduce maternal mortality in Kazakhstan was implemented. The program has shown good results. In 2015 was started the development program in Kazakh and Mangistau regions. These regions were chosen as the most problematic ones. If we talk specifically about the program of Mangistau region, we continue to support the healthcare management to reduce maternal mortality, where we work and assist in strengthening the work on effective perinatal technologies, that is, that mortality in maternity did not happen in wards and perinatal centers. Another direction of the program is education, that is, raising awareness among young people about reproductive health. According to a study of the United Nations Foundation, about half of young people are sexually active before the age of 18. In this regard, in Kazakhstan, there is a high rate of teenage fertility. The UN believes that childbirth in adolescence is not only dangerous to the health of the girl and her child, but also gives rise to a vicious circle of poverty. If there was a teenage pregnancy, a woman usually cannot finish school, that is, even get a secondary education. No education, no work respectively. There is no work, she will be in poverty. If her partner leaves her and she appears with health problems and cannot pay for her healthcare services, and children born will follow the mother's example, will tend to what she had, a teen pregnancy, and this circle can be endless. Therefore, experts, doctors and educators have prepared a special course on valiology with an emphasis on reproductive health. Today, the course is introduced in colleges of Mangistau and Kazakh regions. It has already covered more than 3,000 students. The first thing that is said in these courses is that we should not jump to the start of sexual activity. Sexual initiation is associated with certain health risks: the risks of an unplanned pregnancy, abortion, the sexually transmitted infections. The methodology is very unique, I would say. It uses interactive teaching methods, and indeed we have seen that there is a great demand among young people for the knowledge in the field of reproductive health. The UN also helps to improve the service of family planning. In 2015, they developed clinical guidelines to improve the knowledge of obstetrician gynecologists and general practitioners in Kyzyroda and Mangistau oblasts. At the same time, Mangistau region for several years has been the leader in fertility among other regions. The top three also include the city of Astana and South Kazakhstan region. In general, over 2016, the population of Kazakhstan increased by about 275,500 people and continues to grow.